Stephen, thank you so much for being with us in this disturbing times, I must say. The events have been snowballing, as we just discussed, in the past few days at the backdrop of the optimistic speech that the U.S. president gave just a couple of days ago. We're hearing about new cases of coronavirus in California, first community transmission, and 8,000 people monitored in that state alone for the cases of coronavirus. Judging by what we're hearing and seeing right now, what can you say about the state of preparedness here in the United States now that it is close to home?
Well, you're correct that we're in a new phase, right? We're in a new phase in the whole outbreak. Earlier, the thought was that the outbreak could be contained in China, and that we would put a travel ban in place against folks coming from China. We would quarantine some Americans who had been there recently, and that was the strategy. Well, that's now given way to a strategy that says this is now globalizing. It's in an accelerated transmission. We're now in 50 countries. We've got as many new infections outside of China as inside China. So now the strategy is how to prepare for more and more cases and how to mitigate the effects of this. Now, right at the moment, we have a relatively small number of cases in the United States, under 100. It's about 60 or 65 cases. Almost all of those are from the cruise ship, the Diamond Princess, or they were folks that were evacuated. We're not expecting major new evacuations, but what we're seeing, and you referenced in California, the first, what we're calling human-to-human community transmission. And in other words, an infection, we're not sure where it originated. It's not tied to being in China or being the relative. It just appears, and suddenly that's a sort of signal that we're seeing something that resembles what we saw happen suddenly in Iran, in Lombardy, and Veneto in northern Italy, in South Korea, where we have over 2,000 cases suddenly. So how prepared are we? I think that's the fundamental question that's on the table right now. And what's the strategy? So in order to prepare ourselves right now, in the United States, it's really a matter of communities, municipalities, states leading the way in the preparations. And what are they trying to prepare for? Right now, we're in flu season in the United States. Our hospitals are already operating at 97% capacity. So if we have a surge of people who are coming to the hospitals who may not be sick, they may be the worried well, that can overwhelm our system. If we have a lot of people who are quite ill because of the virus, and they come in, where are we going to put them? How will they be tested? There's several things that need to happen. The testing has been way behind schedule. We've had technical difficulties. Very few people have been tested. Only a very select, narrow number of people have been tested. There's a race to get better tests available on scale. Those in the leading the responses in the states are demanding quicker and quicker action. CDC is moving the best it can. It's now in the third iteration of its tests. So tests are very important. Second is the protective gear that's needed in the hospitals and clinics. And that's gowns, masks, and then we need to have basic palliative medications in stockpiles, right? Ibuprofen, aspirin. We need to have tightened and better infection control in the facilities, because the transmission of this can be on a surface, it can be person to person, it can be by various other means, fecal, oral transmission. So sanitation standards and hygiene are very, very important in this period. What we do not have today in the toolbox is we do not have a vaccine, we do not have an antiviral for this, we do not have a cure, and as I said, we're racing to get a reliable, effective tests on scale. So that's the race that's underway right now. The one thing that's going to be terribly important in this response is people's behavior, because there's a lot we do not know right now. There's a lot of fear, And as the cases begin to multiply, that fear is going to go way up. People are going to be scared that they are infected. They're going to be seeking care. We don't have vaccine, antiviral, or cure. The major thing that we're going to be reliant on is social distancing. And what is social distancing? Social distancing is a term that really means stop congregating in various ways. That means schools may be suspended. People may elect not to take trips that were planned for recreation, vacation, work. They may not be going to conferences. They may not go to church in the same way or go to sporting events or plays. They may work at home. There's going to be a period in which we have a change in practices in the way that we behave. Lots of hand washing is going to be emphasized. A lot of changing the greetings. We were talking earlier. People are already, it's interesting, on the street here in Washington, D.C., people are already holding back from shaking hands, doing those sort of normal things. Your close friends, you might give them a hug. It's becoming less and less. It's people are distancing themselves because they know that's just a good precaution. There's a lot of hazards at the moment. We can talk about those. There's a lot of fear that we'll have disrupted supply chains, medications, basic commodities, masks, gowns, for instance, basic medications. We know that with the economic changes that have happened, as the world has entered an economic crisis this week, the markets fell by 13% since Monday. $3.4 trillion in market value disappeared in this stunningly fast way. Well, this is a reflection of a change in investor behavior, thinking this is going to last longer, it's going to be more disruptive, it's going to be costly. People are now saying no profits in American corporate sector for all of 2020. The calculations are changing now. What happens when you have disruptions and dislocations in the economy at the same time that you have a public health crisis? How do you deal with those two things at the same time? How do you get people back to work? How do you fix, in China, this has been a tension, right? I mean, they imposed in January, in the third week of January, draconian, astonishingly large quarantine measures on people.
And it sounds like it's been working from what we're seeing right now. The outbreak there is kind of going down, right?
It's working to the degree that we are seeing today that there's been a decline in new infections and in death rates. But China's not out of the woods yet, but the Chinese did make a decision. There was a long delay in the Chinese response from when they first knew about this in December until declaring in January. Then there was a swift set of actions. Over 100 million people put into complete lockdown, and another, up to half of the population, over 700 million people, in controlled movement. Yeah. And the idea was this would slow transmission, buy time, allow them to catch up with their system was overwhelmed. Well, for us in the United States, you can argue that the Chinese did the rest of the world a certain service. What they did was buy time for us to prepare.
Do we use this time?
If you look at where we are right now, how far behind we are in getting tests, we're now racing to put a supplemental through Congress, an emergency funding measure that will bring forward desperately needed funds for the state and local governments to reimburse them and help them buy critical commodities and help with several of the other major emergency needs that they require. So I think we're playing catch up. I think we have, by comparison with China, it's important also to acknowledge we have a much more competent public health system. It's not perfect. It has some gaps. It has some weaknesses. But CDC, which serves to support the states and municipalities around the country, it doesn't direct them. It supports them. It has 14,000 career employees. It has another 10,000 contract experts that work for it. Across the United States, we have about 200,000 public health professionals staffing these public health agencies. So we have a better infrastructure, but it can quickly get overwhelmed. When we imposed the travel ban on January 31st and began quarantining people, we reached a peak of about 800 people that came in to be quarantined. They were put into military bases, but the state public health officials were asked to step forward to provide the basic care for them. This was a huge burden. They weren't prepared for this. They didn't have spare capacity and the like. And that was just one indicator of what may lie ahead. We don't know with respect to this outbreak and this virus, COVID-19, we still don't know some fundamental things, right? We don't know its source, the animal source. We know it's very contagious. It spreads very, very rapidly, but the actual transmissibility is not totally understood. We know that you can be infected, but not even know you're infected and not be symptomatic, feel perfectly well, and you can be transmitting to other people. How much of that happens when you're asymptomatic versus when you're really sick? Probably the majority of the transmission is when you're coughing and wheezing and droplets are infecting other people. So we don't know exactly all of the modes. We know that it's transmitted by surfaces. How long does the virus live on the surface? We know that there's fecal-oral transmission in unhygienic, unsanitary settings. So we need to know much more about that. On the severity side, we don't fully understand how deadly this is. What is the case fatality rate? And what is the rate of extreme illness? The only real data set we have, epidemiological data set, comes from the Chinese, which released figures recently on the first 45,000 cases they had analyzed. And they said that across the board, the fatality rate in their figures was about 2.3%. And they said that about 14% were extreme illness. Now, those numbers are scary numbers. You need to put them in context. SARS in 2002 and 2003 was 10% fatality, but it was not very transmissible. Only 8,000 cases, 770 deaths. We reached 8,000 cases of this particular coronavirus in a matter of just a few days. We're now at well over 80,000 cases and climbing very rapidly. So it's not as deadly as SARS. It's not as deadly as another coronavirus, MERS, the Middle East syndrome, which is 35%. But nonetheless, 2.3% is about the same rate as the 1918 Spanish flu, which spread worldwide and killed over 50 million people. So we have to step back and say, okay, how quickly does this spread? And do we get a base population that is infected? And when you have a denominator like that, a base number like that, and it's 1% or 2%, that adds up to a lot of people who are dying. And if it's 14 or 15% of severe illness, that's a huge number of people flooding your system. So we need to think about all of this. Now, those numbers are just the first numbers we have. It may turn out, we hope, it may turn out that the fatality rate is much lower as we get a more accurate count. How many people in our population have this virus? What's the true base of this mountain? It may turn out that it's 1% or lower than that. Let's hope so. Seasonal flu here in the United States, it kills 35,000 people a year. It infects 19, 20 million people. The infection rate, the fatality rate, is 0.1%. 0.1%, 35,000 a year. 2 years ago, we had 80,000 deaths in 1 year. It overwhelmed our system. So if you have that, just as a point of comparison, let's say it spreads to infect a quarter of our population, a quarter of 340 million people, and then you say it affects 1%, those numbers pile up, very, very high. So I think that's what people are struggling with. We don't know the true severity. We don't know the true population that's affected. We don't know everything we need to know about the transmissibility. But the epidemiologists are saying this looks scary and we need to be very careful and prepare ourselves as best we can in this circumstances. The other thing I want to say is we have the near-term challenges of this spreading, people being worried, overwhelming the health system, supply lines disrupted, supply chains disrupted, people being frightened. You have to communicate very clearly to them. This is what we know, this is what we don't know. Stay calm, engage in social distancing and the like. We don't have vaccines or antivirals now. But on another track, you also need to be moving forward very rapidly to get vaccine candidates into field trials and to begin repurposing therapies that you have to treat other things to see if they can help in this case, and also get new candidates for antivirals into tests.
That was my next question, vaccines. And we're getting contradicting statements as to when it might be ready.
Yeah.
And I just wanted to find out from you if you have any concerns as to who might actually manufacture those vaccines, because we have had cases when companies were burnt out by emergency vaccines, and we know that something is being tried and tested right now. But do you feel that there is a clear sense of someone who can step in and actually start producing it when it's ready?
Well, that's a great question, and it's one of the great unknowns, frankly. I mean, I think you've identified one of the really critical issues. If we enter an outbreak that affects a very large population, and we know we need to move to a vaccine that's safe and effective as quickly as possible, and then we have to manufacture it on a scale, where will that manufacturing capacity be? Because it's not like there's huge amount of spare manufacturing capacity. Almost all of the manufacturing capacity is being put towards commercially productive use at this moment. So we have to think about lining up those facilities ahead of time. There's going to have to be guarantees around reimbursement. There's going to be very high financial requirements to purchase the product and then to manufacture it after you've gone through the several stages of three phases of field trials of the safety and efficacy of these candidates. So it's going to be very complicated in that way. Some firms that have deep pockets and great capacity globally have stepped forward. Johnson & Johnson has stepped forward. There are other firms that have stepped forward. Many of the firms that are bringing forward the candidates for vaccines are small biotech firms. So they don't have deep pockets and they don't have integrated large-scale manufacturing capacity like Johnson & Johnson. So we're going to have to think about that.
Stephen, do we have a leadership potential for just making this all happen? Because you mentioned that a lot of hopes were put on the states, on the local facilities, I guess, to come up with ways to initially just face this crisis. Are you expecting that there is going to be a meaningful centralized effort to actually direct this crisis, if it can be directed?
Well, you know, there's been a lot of debate in the last few days about the U.S. approach. Is it adequate? Is it coherent? Who's in charge? Is it up to the task? What are the main messages? How is it approaching this? And there's been some shuffling and reshuffling. On January 31st, when the White House had a press conference, they announced that the travel ban would be imposed. They announced a national emergency. They had formed a task force chaired by HHS Secretary Alex Azar, and they announced the people that were on this. So that was the structure. There was a lot of debate, and we've been part of this debate about whether it is essential that the White House play a leadership role and that there be a strong and coherent, skilled directorate at the White House with responsibilities around global health security, biodefense, both at home and abroad. That capacity did exist. It was dismantled in 2018. And so people have been saying, you need to restore those basic capacities within the White House. This is this is a challenge that cuts across many, many different sectors. It requires many different actors to come forward. It requires solving problems that you didn't anticipate. For instance, the quarantines. You bring in the people for the quarantines, you put them on military bases for 14 days. You ask the state health people to take care of them. And then at some point, the federal government says, let's transition them into Costa Mesa or into Anniston, Alabama. And there's community reaction. People are fearful. And then you get into a collision. Well, who's there to adjudicate, to explain, to work things out? You need a strong hand that's able to operate. This has big diplomatic requirements to it. We have to be thinking not just of America, but of other countries that are going to be affected. It's a global economic crisis. We're balancing both the public health and the economic, and there's a tension there between that, right? We've seen in the president's own statements saying, well, the claims that were made by our senior CDC officials that it's inevitable we're going to see more cases in the United States. The president said, oh, we shouldn't be saying that. That is going to stoke fears that are unfounded. And maybe it's Democrats and media who are doing this, when in reality it's what the public health professionals are saying. Well, part of that is a tension and a fear that the markets are going to be disrupted and the economic damage is going to accumulate. And of course, that is a threat to the re-electability of President Trump. He's not alone. I mean, President Xi in China worries that if he fails, that he'll be thrown out, that his reputation and standing will be damaged. The leadership in Italy and Iran and South Korea and Japan face similar threats. This is not just here in the United States where we have this tension between the public health response, what is happening, how do you communicate clearly to your public, versus the let's not bring on more economic dislocation. The other thing I want to say is the perspective in the early phase of this was, this is short term, it's containable, it'll go away as we get into the summertime.
And that was wishful thinking, as we see now, right?
Right now, it looks like that was wishful thinking. It was not, it was understandable, right? The SARS came in the fall of 2002. It was only declared, this is in China, it was only acknowledged by the Chinese in April of 2003, but by the end of August, it was done. 8,000 cases, 770 deaths, but it came and went. The dislocations to the global economy were like this, right? It was like a sharp dip and a sharp recovery. So a lot of people in the private sector, a lot of economists, a lot of market analysts were saying, let's hope that's what happens. But it's only recently, with what we've seen in the spread outside of China, the combustive spread of this in community-based, sustained spread in South Korea, Iran, Italy, that people changed their conception from, we're no longer in a containment mode, we're no longer in a short-term mode. This is going to stretch out longer, and we want to try to avoid we want to try and take actions like social distancing, spread out the growth of this, slow the growth some, and manage it in a more effective way.
Stephen, thank you so much for this in-depth analysis. I wish we had more time in the studio, but I'm sure, and maybe it's not good news, we will have more to talk about in the future, and I'm hoping to see you here again.